Safety is the paramount feature while working in industry or office. When you learn about first aid, you might hear about DRSABCD and ABCD. You can save yourself and others during on-job accidents or emergencies at home. So, what does these stand for in first aid? These are explained in this lecture for the benefit of everyone in emergency situations. This lecture prepared by Technology Education and Mentoring Center focuses on the steps needed to save a life, like making sure the person can breathe and using a defibrillator if needed. Knowing these steps helps you stay calm in emergencies and can help save lives. Consider taking a first aid course for more comprehensive training. This presentation has 3 portions as shown on the screen. Most important is segment number 3 that teaches tips for remembering and applying these first aid terminologies and procedures while facing emergencies. DRSABCD and ABCD are both useful, but they have some differences described in this slide. First segment describes the terminology of DRSABCD. This is a set of steps to follow when you find someone who needs help. Each letter stands for something you need to check or do. CPR is performed if the person isn't breathing by chest compressions, and rescue breaths until help arrives. Use an automated external defibrillator, AED, to shock the heart back to a normal rhythm. These are simple codes or shortcuts used in first aid and emergencies to help people remember what to do when there is an emergency. Let us see what they mean in details and why they are important when someone needs help. These steps help guide you in providing proper first aid in an emergency situation. It helps you remember the right steps to take in an emergency. By following these steps, you can quickly figure out what kind of help the person needs. Each of the 7 steps are individually flashed on preceding screens for better understanding of the concept. Look around. Is it safe for you to help? Check for things like fire, traffic, or falling objects. Don't put yourself in danger. Check if the person is awake. If they don't answer or move, they might be unconscious. Call universal helpline numbers as designated in each country like 1122 or 911. Call hospital or medical doctor. If the person is unconscious, gently tilt their head back and lift their chin. This helps open their airway so they can breathe. Look, listen, and feel for breathing. Watch if their chest is moving up and down. Listen for breath sounds. If they're not breathing, you might need to start CPR. Check for signs of blood flow. Look for movement or coughing. If there's no pulse, start CPR right away. Second segment is all about ABCD applied to first aid. The mnemonic, ABCD, stands for airway, breathing, circulation, and disability. First, life-threatening airway problems are assessed and treated. In second phase, life-threatening breathing problems are assessed and treated. It is easy to remember in a stressful situation. It reminds you to check the most important things first. Here is what ABCD means. Check if the airway is clear. Check if the person is breathing. Look for chest movement. Feel for breath on your cheek. Check for signs of blood flow. Look for movement. Special machine called a defibrillator helps restart the heart if it has stopped. Segment number 3 teaches tips for remembering and applying these first aid terminologies and procedures while facing emergencies. Remembering these letters can be hard, especially in an emergency. Some tips are flashed on the screen. You might use these steps in an accident or emergency. Remember, the most important thing is to stay calm and call for emergency help if you're not sure what to do. Knowing DRSABCD and ABCD is important because you can help someone quickly and safely. You might save a life by knowing what to do. It helps you stay calm in an emergency. You can teach these steps to other people. This first aid sign is a universal symbol, used to indicate the presence of first aid equipment, first aid treatment, or first responders. This can be seen as a white cross on a red or green background. Knowing the first aid kit sign could keep you safe. Remember, knowing the first aid kit sign and remembering DRSABCD could keep you safe.